Hi, everybody. Welcome back to Promoting Health Literacy with free information and cool tools from your National Library of Medicine. This is session 3. Our goal is to see what promoting health literacy actually looks like when it's happening on the ground. Previously, we said that promoting health literacy is a two-part challenge. It means first enabling a person to find information that is reliable, understandable, and actionable, and then enabling the person to use that information to make choices about their health and healthcare and transform those choices into their desired actions and outcomes. In session 1, Gail Kwame from the Pacific Northwest Regional Library of Medicine demonstrated how to use Medline Plus and other national treasure troves of free health and medical information to find good information. That was also a demonstration of how you can introduce those resources to the people that you work with and enable them to find information on their own. In session 2, I suggested that an effective way to enable a person to move from information into health-promoting action is to ask them reflective questions. A good reflective question is like a good sandwich. It's thick and meaty. It takes up time and space. It requires chewing on. So a question that you can answer yes or no, or with one word, or that you can look up in a book, that is not a reflective question. Reflective questioning is an evidence-based promising practice. An independent review of the evidence, commissioned by the Agency for Healthcare Research and Quality, concluded that routine reflective questioning by a home visitor enabled mothers to better manage their health and healthcare. It promoted their health literacy. And so reflective questioning was named a quality innovation, and it is featured on the website Innovations Exchange. In addition to reviewing the data, the evaluators interviewed practitioners who were trained in reflective questioning and were using it in their work. One of the evaluators wrote Dora's story. It's about Dora McKean. She's a real-life early Head Start health educator working in California. Dora became a master of reflective questioning, and her story illustrates beautifully how to lead a reflective conversation. Now, ideally, each of you would get to meet Dora and you would shadow her on several visits and see reflective questioning in action. That's not really feasible. So Gail and I are going to role-play Dora's story for you. As the story unfolds, you will notice that Dora builds her reflective conversation around these 3 most basic reflective questions. Asking the person, "What do you want?" opens the space for them to clarify and articulate, often for the first time, what they really want, their best possible desired outcome. Asking, "What have you got?" opens the space for them to really figure out, where am I now? What's working? What's missing? What's wanted and needed? And the final question, what's next, is an invitation to state a baby step that the person is willing and able to take now to move a little closer to her desired outcome and open the space for the next step. So now, as you watch and listen to our reenactment of Dora's story, notice how Dora uses forms of these 3 basic reflective questions to lead the young mother, as if in a dance, to think and talk her way through a problem to her own solution. As we begin, Dora and the teenage mother of a 2-year-old daughter are sitting together watching her child play. They notice that the child stops suddenly, gasps for breath, and hides her ball.
Did you see that? She does that all the time. She'll be out there playing, and then she'll just go hide the ball.
A reflective conversation almost always starts with what the person does not want, with a complaint. So listen carefully to complaints, because she will complain about the thing that she cares about. What she really wants is behind her complaint. This looks like a good opening for Dora to educate this mother about childhood asthma and maybe make a referral to a specialist. Let's see what Dora says. Any idea why she does that?
I don't know. I've taken her to the doctor. He's listened to her lungs. He says there's nothing wrong. Then we come home and she'll play and kind of have a little trouble breathing and hide the ball like that again.
Well, the doctor says it's not important, but clearly you're still concerned. Have you thought about other ways you could get information and find out what's going on with her?
Well, I don't like to take that much time at the doctor's office because he's always really busy and it's kind of intimidating.
Okay, what other options do you think you have?
Well, I suppose I could.
There is where Dora ended the visit. She left the mom thinking, reflecting about how she can obtain information that she can use to improve her daughter's health and her health care.
So I went to the library like we talked about, and I looked up information on Medline Plus about asthma in children.
Oh, good job. This is good information.
Thanks.
I can tell you've really been thinking about it, too. What's your next step?
Well, I decided I'm going to try to find a different doctor, somebody who's friendlier and has more time to answer my questions. And I also want to take my husband with me for support. And we decided we're going to ask for a referral to a specialist.
Okay, that sounds like a good plan. Good thinking.
Thanks.
So have you thought about how you're going to explain your daughter's symptoms to this new doctor?
That's a good question. Maybe.
A lot happened in this reflective conversation. What didn't happen is that Dora gave no information and she gave no advice. By asking reflective questions, she kept the mother in charge of her own learning. Starting from a vague complaint, Dora was able to lead the mom to make a clear statement of what she really wants, her desired outcome, and then to understand what she needs to learn and do, and finally to name not one but 3 steps that she's willing and able to take now to move in that direction. So we can say that this reflective conversation empowered the mother to find information and use it to make a choice to find better medical care for her daughter, and then to transform her choice into her desired actions and outcomes. That's the gift of a reflective question. Now, it might have been quicker for Dora to just give the mother information and tell her that she needs to take her daughter to see a specialist. She might even have made the call to set an appointment with the specialist herself to make sure that that happened. But that would be disempowering. That would convey to the mother that she is somehow inept or incapable or unreliable, and it would make her dependent on Dora. It would leave her feeling powerless in the face of a hurried clinician who dismissed her concerns. So by asking reflective questions, Dora created opportunities for the mother to develop the skills that she needs to manage the healthcare system and keep her daughter healthy.
No one has ever asked these parents for their opinion before. They start stumbling and saying, I don't know. But over time, they learn to ask questions and think for themselves. And that success affects them and their children for many years to come.
So I hope you will want to try out reflective questioning and consider adding this framework for leading a reflective conversation to your toolbox. We'll leave you with the gift of some reflective questions for your discussion and contemplation.